Imagine a scenario where a nurse and a client engage in a meaningful conversation, using words and gestures to understand and address the client's emotional and physical needs. This is the essence of therapeutic communication in nursing. Now, let's delve into the fundamental principles of therapeutic communication. We'll start with the positive actions that can enhance your communication with clients. Active listening. Face the client at eye level and maintain eye contact. Have a controlled voice, tone, and speech. Ask open-ended questions and promote discussion. Open-ended questions are not simply yes or a no questions, rather they require an in-depth response. For instance, imagine you're talking to a patient who recently lost their aunt. You could ask, what kind of relationship did you have with your aunt? This open-ended question can lead to a deeper understanding of the client's emotional state and needs. The goal of therapeutic communication is to build trust and obtain important information, so nurses should ask and assess the client's emotions. For example, they may ask the client, how do you cope with your anxiety? Repeating the client's words to confirm what you understand and allow for clarification. For instance, the client may state, I won't ever be able to use this electric wheelchair. The nurse responds, you're concerned you won't be able to use the devices on your new wheelchair. Silence allows the client to consider their thoughts. Sitting quietly with clients as they collect their thoughts fosters the therapeutic relationship. For example, the nurse may say, I will sit quietly with you, I can tell you have something serious on your mind. State facts. Providing, simply and directly, specific factual information the client may or may not request. When information is unknown, the nurse states this and indicates who has it or when the nurse will obtain it. For example, the nurse may state that you will feel a pulling sensation when the tube is removed from your abdomen. Reflecting returns focus to the client. An example of reflecting. The client may say, what do you think I should tell my kids about my diagnosis? And the nurse responds, have you considered how much you are comfortable sharing with them? Let's discuss non-therapeutic communication because it does not foster nurse-client relationships. Do not ask closed-ended questions, they result in yes or no answers and do not facilitate communication. Do not leave the room, stay with the client to show support or use therapeutic touch to show empathy. Do not ask a why, it closes communication, and clients may find it intrusive or judgmental. It destroys the nurse-client relationship. Do not offer any advice or opinions. For example, the nurse may say, my mother also died of cancer, so I understand what you're going through. It takes away decision-making and does not allow clients to express their feelings. Do not give false reassurance. For instance, saying, everything will be fine, can block the client's fears, feelings, and thoughts. It also discourages further expressions of emotions by the client. Do not minimize the client's feelings. For example, the nurse may say, I know what you are going through. This also discourages further expressions of emotions by the client. Changing the subject. Changing the subject when the client tries to communicate with you demonstrates a lack of empathy and blocks further communication. As you can see, therapeutic communication is vital to your nursing practice and client communication.